We are here at Massachusetts General Hospital in honor of Pain Awareness Month for the Pain Center Facebook Live question and answer session. I'm Dr. Daniel Southern. I'm one of the pain medicine fellows here. And a quick note, please be aware that Mass General will be live streaming this session and recording this presentation on social media. The Mass General staff are trained in patient safety and privacy. This presentation is only for informational purposes, and if you have any specific questions, please consult your doctor. So as we get started, I'd like to introduce one of our pain medicine physicians here, Dr. Dan Pock.
Thanks. So again, my name is Daniel Pock. I'm one of the physicians here at the Pain Management Center at Mass General. I am an anesthesiologist with subspecialty training in chronic pain. And so we see and treat kind of the full spectrum of chronic pain syndromes. So it can range from simple to complex back pain, as well as neuropathic pain syndromes or nerve pain syndromes, joint pain syndromes, cancer pain syndromes, and so we kind of see it all. Our job as pain management physicians is to be able to tailor the treatment plan really according to the patient's needs and their preferences. So sometimes that means managing their medications and doing conservative management. Other times it means offering them more aggressive modalities of treatment like interventional therapies. The topic that we'll be talking about today is back pain, and I think that's a really important subject to hit upon because that's probably one of the most common complaints we get in the chronic pain clinic.
It is a common complaint, and so let's start off with how many people have back pain in general?
So about 80% of Americans at some point in their lives, whether acute or chronic, will develop back pain. What we do know also is that back pain is the single largest cause of disability worldwide. In terms of Americans, it accounts for roughly $50 billion in healthcare costs. If you then account for the fact that there's lost wages and also decreased productivity from days lost at work because of back pain, that balloons to about $100 billion, so obviously not an insignificant problem.
How do you define these terms that we hear in the media of chronic back pain versus acute back pain?
So most pain or most back pain is due to acute back pain, and that's defined as back pain that lasts anywhere from several days to several weeks. Usually this is due to some kind of mechanical disruption. What we see most often is actually muscle strains. So after patients maybe twist their back or after lifting heavy items will present with back pain, these are usually self-limited and resolve on their own. The other issue in terms of chronic back pain lasts for about 12 weeks, for 12 weeks or longer, sorry. And what we know also is that 20% of acute back pain syndromes will eventually evolve into a chronic issue.
Great, so you mentioned a couple of common causes, but what other causes of back pain can we have, and are there any that are a little bit less well known than the common ones?
Sure, so we'll use this kind of spine model here. So we just talked about acute back pain. The most common cause of acute back pain, again, is muscle strain. Okay, so there's muscles that connect that are in the lower spine. Again, that's usually self-limiting. What we also see very frequently in the chronic pain clinic is back pain coming from the lumbar spine, and so there's joints in the lumbar spine called the facet joints. This is what allows the spine to basically flex and extend. So there's a lot of movement there. Over the course of time, as people get older, you can get arthritis in these areas of the spine that presents with back pain. Another common area of back pain comes from the vertebral discs. So these are the vertebral discs, and these serve as basically like shock absorbers for the spine. And so as patients get older, kind of naturally these discs get desiccated or they dry out, they lose nutrients, they lose their integrity, and so that can present with back pain. In conjunction with that, you can also get, when you lose the integrity of these areas, slight herniation of disc material that can then compress against the nerve roots. So the nerve roots here come off the spine, and so that often presents with kind of shooting pain down the legs, numbness, weakness down the legs. So when people talk about sciatica, they're oftentimes referring to something that causes compression of the nerve roots. In other areas, again, from what we call the SI joint, and so there's the sacroiliac joints, which is in the lower spine near the pelvis. When you develop arthritis in that area, it can also present with back pain. So obviously a lot of different sources that can present with kind of similar symptoms.
For people who have back pain as a result of a traumatic incident, like a car accident or a fall, are there any specific recommendations that you have?
So in terms of traumatic injuries, if back pain comes from that, then I think I would certainly recommend the patient present to the emergency room. Oftentimes back pain from traumatic injuries are due to fractures of the actual vertebrae or anything that may potentially cause fracture of the vertebrae is something that may be amenable actually to surgical intervention. So that's something that we would actually recommend that they go to the nurse and see a spine specialist for.
In general, what are the modalities which we use to diagnose back pain?
So we use a combination of so obviously you take a history from the patient, also do a focused physical exam in the painful areas, and so oftentimes we'll do kind of provocative maneuvers to elicit the type of pain so we can figure out exactly what the cause is. This in conjunction with imaging modalities, like X-rays, CT, MRI imaging, are the tools that we use to be able to diagnose back pain. One thing I will say is that oftentimes patients, or the imaging doesn't necessarily correlate with the symptoms, meaning we often see patients with pathologies on the actual scan and the imaging, and the patient doesn't present with the symptoms. So what's important to know is that, as physicians and as pain management specialists, we treat the patient and their symptoms, and not just the pictures.
What should patients expect when they come in for an initial visit with their pain specialist?
So in addition to, again, so we would take a focused history, focused physical exam. We would go over any kind of imaging that the patient has already received. And if it's indicated to order more, we would do that. And then also a lot of time spent really trying to understand the kind of the patient's goals and also their preferences in terms of how they want to pursue their treatment. So again, if they want to pursue more conservative treatment, we tailor our approach to that. If they want to be a little bit more aggressive and are interested in pursuing an intervention, then we also will discuss that with them.
In what types of cases are different medications or surgical options necessary to treat back pain?
So provided that this is a chronic issue or even sometimes acute issues, we try to approach it, or what I try to do is pursue a more conservative approach initially. So what I tell all my patients is to keep on moving, so that's very important. So continue your daily activities. Don't do anything that exacerbates the back pain, so don't lift heavy items, for example. However, what we do know is that lying around in bed rest is actually an independent risk factor for the development to chronic back pain. So that's why also engaging in rigorous physical therapy is actually really, really important. It strengthens the core muscles, helps with posture, and I think that's something that a lot of patients will dismiss because yes, it is a lot of time, a lot of effort that's required. However, having said that, the data shows that the long-term data is good in terms of the outcomes if you participate in these things. Oftentimes we'll recommend medications, so a lot of patients will take Motrin or non-steroidal anti-inflammatories. With the guidance of a pain management physician, you can also choose to pursue medications like what might be recommended to you is a low-dose muscle relaxant, an antidepressant, or an anti-seizure medication, which actually can be used for nerve pain if that's a component of your back pain as well. And then in addition to all those things, again, if the patient is interested, then we would also talk to them about a minimally invasive procedure that's targeted at the cause of the back pain. I find that really taking this multimodal approach not only leads to better patient satisfaction, but also leads to better outcomes. In terms of surgical interventions, oftentimes that's indicated when they failed a lot of the more conservative options, and there's a focal area where surgical intervention can actually fix the potential issue, obviously. So that's something I would defer to the spine surgeons about.
We actually received an audience question just now, and what is the relationship between sitting and back pain?
So sitting in and by itself is not an independent risk factor for back pain, contrary to popular belief. However, a lot of data has been shown that prolonged sitting as well as exposure to whole body vibration, so you often see this in patients or in driving occupations, for example. That kind of up and down motion, however small, can cause undue stress on the facet joints of the lumbar spine and also the vertebral discs, and so that can cause, actually, is a risk factor for back pain. Also, prolonged sitting with poor posture, and so overarching your back or slouching is also an independent risk factor for development of chronic back pain. So we often see, for example, dentists who come in who have these issues, and so those things that we often see.
So in that light, what lifestyle adjustments do you recommend for people either at home, school, or work to either prevent or improve their back pain?
Yeah, absolutely. So what a lot of my patients find helpful actually is first of all using, for example, a standing desk if your occupation requires you to do a lot of desk work. So using a standing desk that strengthens the core muscles. It also helps with posture. In addition to that, also helps with kind of burning calories, so they like that. Also, getting up and walking around, so maybe setting an alarm on your phone for every 30 minutes to an hour, just make sure you're actually standing up. Whether it's just a couple minutes actually helps, it breaks the monotony of just sitting down all the time. Also, using an ergonomic chair. So what I mean by that specifically is using lumbar support. So that's actually very, very important to supporting good posture. Oftentimes, if you can't get that, then you can use a pillow and put it underneath, right behind your back. You can also roll up a blanket to provide lumbar support. I also tell all my patients who come with this kind of question to also plant their feet, so keep your feet on the ground. If you're crossing your legs while you're working, that's not really promoting good posture, and so over the course of time, if you keep doing that, it can also cause undue stress on the back. And also, if you're working at the desk a lot with a computer, keep everything within arm's reaching distance. So if you have a keyboard, mouse, keep it close to you, so you're not extending constantly to have to do that. Again, promoting poor posture.
Are there any simple stretches that you recommend for back pain?
Sure. So one thing I think that that works very well is actually kind of doing a plank pose, right? So if you do that, that helps with kind of strengthening your abdominal muscles, also the back muscles. It prevents a lot of the issues that people have with muscle strength, for example, and it really strengthens your core, which is, again, something that we emphasize a lot. Another exercise that I think is extremely helpful is when you're lying on your back to actually pull your knees to your chest. And what that does is actually stretches the gluteal muscles, also the lumbar paraspinal muscles, and also the lumbar, or all the back muscles in the back. Helps with, again, strengthening your core and making sure that you're not suspect to muscle strain.
What other lifestyle adjustments can people make to either prevent or mitigate back pain?
So in addition to all the things that you can do in terms of kind of, work modifications, I always recommend the patients try to lose as much weight as possible. So the more mass you have on the spine, again, the spine supports the body, right? So the more mass you're putting on the spine, the more stress you're putting on the facet joints, the vertebral discs, and so anything you can do to offload that stress is helpful. Also, for patients who do smoke, I encourage them, in addition to all the other health benefits you get from stopping smoking, it also helps with back pain. It's smoking or long-term smoking is also a risk factor for poor health of the discs as well, so that's something that I encourage your patients to do, is to stop smoking.
Great. So I think we may be getting a viewer question here. Okay. So actually, we're just going to wrap up and hand it over to Dr. Pat.
Okay, so thank you for tuning in. Again, my name is Daniel Pac, one of the pain management physicians here at Mass General Hospital. If you'd like further information regarding back pain, or if you'd like to see a specialist, you can always visit us at www.massgeneral.org/Center for Pain Management. You can set up an appointment there. Thank you for tuning in.